So I'm Marilee Brockway, also known as Meredith Brockway, and I'm an assistant professor at the Faculty of Nursing here at the University of Calgary. So donor human milk in Alberta and Canada is provided through the Human Milk Banking Association of North America, which is also known as HMBANA, and it's standard practice for sick and preterm infants. So pretty much any baby born in Alberta will get that as part of their care when they're in hospital, and most of Canada as well. So what I'm looking at is providing donor human milk to infants outside of the preterm context, in the full-term context, who have experienced adverse exposures to their microbiome, usually in the birthing process. So if they're born via C-section or if they have exposures to antibiotics, we know that that can be detrimental to their microbiome. And so we're looking at the use of donor human milk, which is kind of like a prebiotic, probiotic, and postbiotic in one perfect package, to see if giving that instead of formula supplementation, if they need to be supplemented, can have meaningful impacts on their microbiome. And then longer term, what does that mean for child health outcomes? The Northern Star Mothers Milk Bank is the only community-based milk bank here in Canada. We're very lucky to have them in Calgary. What that means is they can give their milk to any hospital across Canada, and currently they've donated milk to 26 hospitals. So they're not linked specifically to a hospital. What I do with them is we have a really nice community engaged relationship. So we do partner together to do research on milk. They provide the donor human milk, which I do pay for through my research funds, but it's still available for us to use for research purposes. And in turn, I also work with them to help advise them on research. If they have questions that come up that they want answered, then we work together to evaluate those questions and investigate them. So it's a really nice community-based research partnership.